Hello, everyone. To start off, we would like to thank Innovation Think Tank Certification Program team, and we would like to welcome all the jury members. We are team number 8, which consists of me, Iman, a third-year medical student, my team member, Mohammed, a biomedical engineer, Nof and Marwa, who are also fourth-year biomedical students. We are all from Ajman University. In this program, we have visited more than 20 trusted websites and journals and interviewed kidney dialysis patients in order to gain insight into this disease and pathway. To explain our research findings, we started by brainstorming the challenges of the healthcare system. Then we defined chronic kidney disease and looked up the facts and figures that shows its significance, hence the reasons we were interested in it. And we described the disease pathway starting from prevention to follow-up, including the pain points in each phase, as well as the stakeholders involved. Chronic kidney disease, or CKD, is a progressive disease that leads to the loss of kidney function, thus losing the filtration ability of the kidney, needing either transplant or dialysis in progressed phases. When it comes to the facts and figures, we have to know that 15% of US adults are estimated to have chronic kidney disease, which is about 37 million people. And can you imagine that almost half of those 37 million people are not even aware of having chronic kidney disease? They have severely reduced kidney function, but they don't even know it, thus leading to it to progress further, causing a bigger burden on the financial ability of the government and hospitals as well. In 2017, treating Medicare beneficiaries with CKD cost over 84 billion, which is more than 22,000 per person. And due to COVID-19, some patients have shown acute kidney disease that can develop into chronic kidney disease if it's left untreated.
As for the disease pathways, the first phase is the prevention, which can occur at home or at the gym. The patient needs to exercise more and choose healthy lifestyle. The stakeholders of this phase are the patient, his family, and the government. The pain point of this phase is that the patients not follow the instructions on over-the-counter drugs and intake excessive amounts of drugs. So we can implement a sensor that notifies the patient of the right amount of medications, or we can implement an app that connects the pharmacy to the physician. So when the patient takes excessive amounts, the physician can be notified. Also, we can use water tracking apps and nutrition and fitness apps for a healthy lifestyle. The next phase is the symptoms which occurs at home, which can indicate of the condition of the patient, like weight loss and swollen ankles, knees, and feet. The stakeholders of this phase are the patient, his family, and the hospital. The pain point of this phase is that the patient is confused about which specialist they have to visit. So we can implement a multidisciplinary care model, which is a collaborational process between the physician, the healthcare providers, the medical staff, and the patient's family. Or we can use an app that analyzes the patient's symptoms and gives the right department. Also, the patient might confuse the symptoms of the CKD, like shortness of breath and chest pain, with the COVID-19 symptoms, and which causes so it's better to consult physicians before drawing conclusions. And for the third phase, we have the diagnosis, which happens at a hospital, which can undergo many tests to provide the best diagnosis. So the stakeholders are the patient, the radiologist, the hospital, and nephrologist. The pain point is that the delayed referral to nephrologist, which can be solved by increasing the awareness and limiting the intake of things that may affect the situation of the patient. We can also, the need to see several specialists in case of having other issues can be a pain point, which can be solved also by multidisciplinary care model. And finally, due to lockdown, patients cannot go to the hospital and do the test, so a special ambulance can arrive to the patient's home and do the test for them.
Following by phase 4, which is the treatment, which is done at home and hospital, which is requiring to add a new modification to the patient's lifestyle. The stakeholders are the patient, nurse, pharmacy, the healthcare insurance, hospital, nephrologist, and the medical equipment, which are mainly the dialysis. The pain points here are the inability to understand the treatment plan due to inadequate education, as most patients do not know what their treatment plan or what's the disease that they are having. It can be solved by a group educational session to raise the awareness. And sometimes the insurance can't cover all the treatment plans, so hospitals should provide a special installment plan for the patients. And sometimes it's very difficult to find kidney donors, and it can be solved by creating an app that connect hospitals with each others. And if there is any kidneys that is available, it can be like posted on this app, and when any hospital requires that, it can order it. The next phase, which is the rehabilitation, it's very important to after the treatment, start the rehabilitation for the patients in order to regain their own or their previous lifestyle. The stakeholders are the patients, family, hospital, nurse, and the rehabilitation centers. And the main points are that the patient's immune system is very weakened after the treatment, so it's important for them to wear a face mask or follow dietary restrictions in order to strengthen their immune system. And the lack of exercises due to the lockdown, so it's can be solved by creating a virtual fitness classes. And finally, the follow-up phase, which is done at the hospital. It's very important to follow up with the patients after the treatment in order to see if their health is getting better. And the stakeholders are the patient, family, hospital, nurse, and medical insurance, and the pharmacy. And sometimes the difficulty is it's very difficult to keep up with regular checkups. So creating an app will solve that problem. And also difficulty following a strict diet. And it's very important to inform the patients about the consequences of not following a diet, and to create an app that will help in creating a diet plan. And also not being able to go to the hospital in the COVID-19, the hospital should create a special transport like vehicles for the patients in order to allow them to arrive safely to the hospital and finish their treatment.
And to summarize it all, we've discussed the facts and figures, we've discussed the disease pathway, we looked at the problems that patients could encounter, and we listed some solutions to them. And our final message is that CKD is a significant disease, especially nowadays during this pandemic, and that more people should be aware of it. And thank you.